Perhaps one of the most striking and underappreciated truths about vitamin B12 is its power to shape our mental landscape so profoundly that its deficiency can masquerade as psychiatric illness. The mind's fragility in the face of low B12 levels reveals an unsettling mystery. The same nutrient deficiency that causes numbness or weakness in the limbs can also warp thoughts, moods, and perceptions, sometimes so convincingly that it leads to mistaken diagnoses of depression, anxiety disorders, psychosis, or even dementia. At the core of this phenomenon lies B12's indispensable role in the synthesis of neurotransmitters and in the maintenance of myelin sheaths that insulate neurons in the brain. When B12-dependent methylation falters, levels of critical neurochemicals, including serotonin, dopamine, and norepinephrine, can drop, disrupting emotional balance and cognitive clarity. The result can be a cascade of psychological symptoms: sudden mood swings, irritability, unexplained sadness, or a sense of hopelessness that perfectly fits the criteria for major depression. Yet in these cases, the cause isn't primarily psychological stress or trauma, but a biochemical derailment driven by an easily overlooked nutritional deficiency. The story grows more disconcerting when low B12 levels cause psychotic features, hallucinations, paranoia, or delusional thinking, which can arise from severe demyelination and metabolic stress within the brain. Historical case reports have documented patients admitted to psychiatric facilities with what appear to be schizophrenia or manic episodes, only for further investigation to reveal profound B12 deficiency. Once treated with high-dose cobalamin, their hallucinations vanished, illustrating how intimately brain chemistry depends on this humble vitamin. Even more subtle is the way B12 deficiency can mimic dementia. In older adults, progressive confusion, memory loss, and disorientation often raise alarms for Alzheimer's or other neurodegenerative diseases. Yet some of these cases, described as reversible dementia, stem from unrecognized B12 insufficiency, where restoring B12 can return cognitive function to baseline if caught early. The tragic irony is that many patients undergo costly imaging and are started on medications for dementia when a simple nutrient repletion could have reversed their decline. Part of what makes this clinical masquerade so mysterious and so dangerous is that many people with low B12 don't present with classic signs like anemia or obvious neuropathy. Instead, they suffer exclusively psychiatric symptoms, leading doctors and patients alike to assume the root cause must be psychological or degenerative. Routine screenings often don't include B12 testing when mental illness is suspected, and when they do, the same pitfalls of normal serum B12 levels can mask true cellular deficiencies. It's a perfect storm for misdiagnosis. Yet amid these unsettling truths lies a message of hope. Recognizing B12's profound influence on the brain creates an opportunity to uncover hidden nutritional factors behind psychiatric suffering. For individuals with unexplained depression, treatment-resistant anxiety, or unusual cognitive changes, assessing B12 status, especially through functional markers like methylmalonic acid, can be a critical step toward resolution. Supplementing B12, whether through diet, oral supplements, or injections, can lead to dramatic improvements in mental health, sometimes within days to weeks, transforming lives once overshadowed by unnecessary psychiatric labels. Ultimately, the phenomenon of B12 deficiency mimicking mental illness is a reminder of how intimately our minds are tied to our biology. It invites us to look deeper than surface symptoms, to consider nutritional roots of emotional and cognitive disorders, and to honor the complexity of the brain's dependence on even the simplest of molecules. In doing so, we gain a powerful tool to reclaim mental well-being and to approach psychiatric symptoms with both compassion and curiosity.